Good morning, everybody. I'm Paul Schmitz, the Manager of Information Services with All Chicago. I've been asked to help moderate this Q&A with Dr. Lyons. So, excuse me. We can get started as soon as Dr. Lyon is ready. We have a series of questions have already been submitted. However, if you do have questions, please feel free to ask them in chat.
Paul, it's Evan. Yeah, you can hear me.
We can hear you.
I'm also having a miserable echo. Hang on one second. Can you hear me?
I can hear you.
How about now?
Yeah, I can hear you.
All right, good. I was trying something to. Anyway, good morning, everybody. Great time to barge in. I'm glad there's a little minute to start this kind of conversation, and I know it's something we'll have to kind of keep up with. Just with everything being so new, as a medical provider and doctor person, I've certainly been around infection and infection control for a long time, and I respect how strange it is for less medical or non-medical people to have to consider working through this kind of crisis safely. So, I'm glad for a time to talk about things. Do you want to start with a question, maybe?
Sure. Let me start with the first question we got. We have let's see, 1, 2, 3. We have a good 7 or so questions, and if there's time for more, I do have a few additional. And then if anybody has some in chat, if we have time to get to them, we can do those as well.
Great.
So the first question is, when the stay-at-home order is lifted and we begin to reopen, for case managers that meet with residents only when necessary for not more than 10 minutes, what protective equipment will be necessary? Should it be gloves, masks, and face shields? If not, what is recommended?
Yeah, for case managers that need or will benefit from person-to-person, face-to-face time, I assume. With non-contact work, meaning not laying hands, doing physical exam stuff like a doctor, or helping a person if they had fallen or whatever, some of the hands-on work that shelter people do. Really, what's needed is distance always, and we'll have to figure out in our spaces a way to be 6 feet or so or more from anyone we're not touching. That person should have a regular surgical mask on, and staff should have a regular surgical mask on. At that distance and with regular surgical masks, there is no need for a face shield. There's no need for gowns. Gowns simply, gowns and face shields are for particles, for spit, for splashing, for sneezing, and at a distance and with someone wearing a mask, it's not required. That's not what we do in our health centers, and it wouldn't be required, in my opinion, for case managers in a shelter setting. We're going to see people using all kinds of equipment in all kinds of different ways, and different places can use make their own choices and such. But really, what's required in non-contact work with someone who's not sick is 6 feet, masks on both people, no need for a face shield and gown in that setting. Gloves are kind of interesting, and I wanted, maybe I'll just talk about it for a minute now and then go a little later too. gloves, obviously, protect the skin from something getting onto the skin. But, coronavirus is not absorbed through the skin. Unlike some things, it's not absorbed through the skin. And I think gloves are a mixed bag. I think they provide a feeling of safety and security. But if you touch a surface with your glove and then you touch your eye with the glove, it's the same as with your hand. And so I think they can make people a little sloppy because you think you've put a protective layer on, and that's not the point. The only protected thing is your hand, and the virus isn't going to get absorbed up and infected through your hand. It's still just a surface that needs to be attentive to. And so in my own work, I don't wear gloves unless I'm doing a high-risk thing like testing someone, but just rely on really frequent, careful hand hygiene and watching where my hands go. So I think gloves are kind of a really mixed bag. There's even kind of medical literature or whatever that shows gloves can make people a little less attentive to where their hands go, and that's ultimately not a great thing.
All right. So, yeah, gloves, right? So the next question.
It's really a mixed bag. Everybody thinks like, oh, I got gloves on, totally good. That the virus will stick on that just like your skin, and it'll still go in your ear, whatever.
It sounds like it's the same as not wearing them, essentially.
For corona, yes.
Right.
Mm-hmm.
So regarding masks, how often are they to be changed? So this particular user says they have a supply of KN95 masks and the disposable masks. So out of those two, like, how often should they be changed?
Yeah. In a hospital setting, ideal world, all the supplies in the world, you would change them very frequently, right? But we're not in that world yet. The CDC is recommending extending the life of masks until they're dirty, right? But that's super imprecise. That's terribly imprecise guidance. It doesn't necessarily help much. What I'm telling my staff is really just common sense. If a mask becomes really not pleasant and dirty, and it's a disposable one, like cloth and washable face masks are another deal. But, N95s, KN95s, or surgical masks are all made of paper, basically, filtering paper of various, thickness and porosity, filtering capacity. Common sense. So if the cloth itself gets sprayed or feels rotten, it's time to replace. And especially if the elastic gets looser, or I think that for me the first thing that kind of breaks down with the surgical masks is the little piece of wire that's usually on the nose part where it tries to get the shape of a nose and create the beginning of a seal. It's not the same as a N95, KN95 with real respirator quality filtration. Those also usually have some piece of wire or metal to make the nose shape. When that gets loosened or that can't be adjusted, that's the time to get rid of the mask. With paper, or thin paper surgical masks, which really are most of what people should be wearing. I don't know that anybody could particularly fault you for wearing a more quality thing like an N95 respirator. But short of doing procedural work that creates aerosols, meaning throwing stuff up into the air, surgical masks are all that's really required. And I think for all non-medical people, there's not really a setting where N95s are required. There's complexity to how they're used and how they work and all that kind of stuff. But, but like nursing and medical providers in the course of regular business in our clinics use surgical masks, no gowns, no face shield, unless we're doing hands-on contact or testing. Sorry, that got a little long-winded. Also say, with a mask, if you're not wearing it a solid 8 hours in a row, like you're taking breaks when you're in an office setting or something else, 2, 3, 4 days is it's very reasonable to keep a mask. And then after that, it's really just common sense. And when some of the parts feel like they're not working terribly well.
So when it comes to then cloth masks, how long do you recommend wearing them before like washing them or like discarding them? Is it around the same idea here?
Yeah, same idea. Although if it's a cloth mask and you can run it through a dishwasher or hand wash with hot water, no harm in doing that every day. There really wouldn't be. With masks, they worked as well as they work. They work pretty well, and the difficulty, the difficulty can be not just while the mask is on, but taking it on and putting it on and taking it off. That time when you're actually touching the mask, which had potentially been in contact with an infected surface, that's actually the more risky time. And if you have a cloth mask and you're able to wash it on a daily basis and get the virus off, that's all to the good. They'll last. They won't last as long, but I would recommend, if it's possible, just washing every day.
Great. So our next question says, I notice there are still limited disinfecting solutions available in stores. Is there anything providers can do, such as creating their own or other brands that may also be good at sanitation?
Yeah. I'll be honest. The answer is going to be yes. I don't know what the solutions and the percentages and the recipes are. Thankfully, with clinics to worry about, we have a facilities person who actually knows a boat ton about that. And I think that's a question we could follow up in writing to the distribution of the invite and to others. Bleach is effective. Obviously, bleach is really rough on, surfaces and things like that. But there's, especially for bulk cleaning of spaces and floors and such, a percentage of bleach will be very effective. It's just a question of how much it's going to rough up your things. And then beyond that, I wouldn't, fathom a guess just because I'd be guessing some, and we can get answers. So why don't we put that as homework and get it back to folks? Because I know there are, just like with hand sanitizer, they're known and respected and high quality, solutions for homemade cleaning stuff. And we'll just find those recipes and get them to everybody.
All right. So back to the face masks. Are there any additional items that are good other than just a cloth face mask? I've heard of adding a coffee filter into the mask for an extra layer of protection. Is that needed or a good idea?
Yeah. So one idea that came early in the prospect of us all needing to make masks ourselves and kind of manage was like vacuum cleaner bags, right? Because vacuum cleaner bags have really high level of filtration capacity. It's called HEPA, H-E-P-A, and that's to keep the dust from blowing back in your house, right? Now, don't go out and buy vacuum bags because they're super expensive, but it's the same principle. So any added layer of filtration is added value. At a certain point, masks get crazy uncomfortable and hard to breathe through, et cetera, but certainly, like coffee filter, even paper towels or a second layer of cloth inside a mask or whatever, any layer that you add is helpful. And there, of course, because this is relatively new, there aren't, clear standards on what that might be, but added layers or added protection for sure, regardless of what they are. The other, the most important caveat with that though is the surgical masks or homemade masks and N95 masks that aren't used perfectly have only modest effect. I wouldn't say that they're not completely effective in preventing the inhalation of the virus and transmission of the virus through the air, and it's because of leaking air around the mask, right? That's why distance is so crucial. Certainly there's, documentation in very controlled settings of greater travel and more time in the air, but still the general understanding of this virus, like coronavirus that's existed, for forever, has been defined forever, is that it doesn't hang in the air for long and it drops pretty quickly. So that 6 feet is really around the particles. But I'm sure people notice, and I notice, I wear glasses. When I have a surgical mask on, usually my glasses get fogged up for a little bit. That's air that's leaking around the mask. That air is not flowing through the mask or through the filtration. It's leaking out the top. Or the other thing I suffer, and I'm sure others do too, is my eyes get really dry. If I wear a mask for too long, my eyes are just super dried out, and that's air that's leaking through the top of the mask and not going through the filtration. So I meant what I said, that, extra layers of filter are good layers. Anything is protective. But much of the airflow in a non-N95 mask flows around the edges, either the sides or top or bottom or whatever. And with that air exchanging, it's not getting filtered, and that's a place where, there could be potential infection. Thankfully, this virus is not transmitted through the air with a lot of frequency. The exact percentage isn't known because testing's not complete and all these other problems that our government's put us in. But the vast majority of infections come from contact, from surfaces and hands. So anyway, that was a long answer. But yes, layers are great, but air often flows around the mask. And, as you're learning to use masks, watch out for how the masks feel and where the air's going. And if you notice, like, wow, there's just a big rush of air out the top, maybe that's a place to work with the straps or work with the piece of wire across the nose and get it sealed down tighter. And if any of you have worn N95 masks, you notice they're a lot tighter. And that's the major benefit of them, is that they're meant to seal very completely across the face. They're hard to use.
Okay, so in lines with kind of what you've already kind of mentioned, I'll ask this question, but I feel like you've pretty much gone over it. So the question was, do I still need to stay 6 feet away from people if wearing a mask or a cloth face covering? And it sounds like your answer essentially is, when at all possible.
When at all possible, yeah. And if you are closer to, sign a document or handle something or whatever, again, hand hygiene and very precise, sanitation on the hands and such, and then limit the time that you're closer. But distance is very, very, very important. And having both folks wear a mask whenever possible. Now, we know that some shelter guests or others that we work with just will, refuse or be even unable, depending on their disabilities. But yeah, if both people can have a mask and you're more than 6 feet away, that's the best measure.
Okay, and let's see. So the CDC emphasizes that people should not wear surgical masks or N95 masks. Healthcare professionals need these masks to stay safe. Instead, homemade masks will protect people who aren't working in healthcare. Is this guidance still correct?
Yeah, I think the guidance is correct, but I also would challenge, kind of who's healthcare right now, right? And hands-on shelter, homeless, caregiving as case managers and shelter staff looks a lot like healthcare. So sure, it's fine guidance, but I would include, whether you want to be or may have some mixed feelings about it, I would include all shelter workers as healthcare workers right now, and as we can get supplies, we deserve them all. And there have been efforts to get especially surgical masks to the shelter providers, and it's gotten slightly better, and I think will continue to improve over time. So yeah, it's good guidance, but you're at the front line, and need the same thing that clinic-based people do.
Okay. And just a reminder for everybody in chat, if you do have a question, please feel free to post it in chat. We do have a few more questions listed here, but if we have time, we'll be more than happy to try and get to that. So a lot of the questions seem to be all tied into everything else that you're kind of covering. So here's one. What is the proper PPE needed when transporting participants?
Yeah, that's a slightly more challenging question. Thankfully, we're coming into warmer weather, and even when it's cold out, I think keeping the windows open is very, very important, because airflow does disperse the virus to a meaningful degree. But inside a pretty closed environment like a car, distance can be less easy. I know many shelters with vans will provide as close to 6 feet as possible. So driver and then folks in the back, and not too many. I think that's a place of greater, you're closer to a guest or resident, and have less complete airflow. So I think in that setting, a face mask might be good to put, or a face shield might be good to put on top of a surgical mask. Gowns could be of more value there, for sure, if you've got them. Gloves, I don't know that gloves are always that helpful, but you could wear them. Just keep them out of your face. And even hospitals, I know it's hard advice to even speak out, because people want the most possible protection they have, but even hospital transporter people who move gurneys around or whatever are not using N95 masks. If you have them, there's no harm in using. They are hard to use. They should be fit to each person. They don't work great with beards or facial hair. They're harder to use, but there wouldn't be harm in trying. But I think the difference there is probably gowns and face shields. And frankly, trying to keep transport to a minimum. It'll slow things down, like a lot of things are slowed down, but that might be something to try and leave to the contractors or fire department who are coming together around homeless shelter needs.
And it sounds also that if you are wearing a gown, to make sure that when you're getting rid of that gown, to wash up just like you would with gloves and not touch your face. And
yeah, taking stuff off, putting clean things on isn't so hard, right? But taking a dirty thing off can be, right? And so, yeah, if you use a gown for transport, as soon as you're done, it should be stripped by not touching the outside as much as humanly possible, and then immediately disposed of. And I do some work that's in close proximity to the virus, both in shelters with you guys and in the clinics. And I leave my clothes at the door when I get home, and make sure they kind of get washed that evening. And so I think that, carrying across the surface is always some potential. So what a gown does is it puts another layer on that you can just strip off, but, get it off safely, dispose of it, and, be attentive to clothing and other things that you bring back to the house, bring back to the home.
Okay, so what is the level of risk of exposure if you're in PPE, but you're in a room with other people who are not wearing PPE?
You won't like the answer, but I think the only thing I could say is it's higher than if they were, right? So there's all the value in the world of wearing PPE yourself, and additive, important value of others around you also wearing protective equipment. And I know firsthand how much of a struggle that can be for many of the people we take care of. And so, minimizing face-to-face time, knowing it's going to compromise some of the care we give, continuing to encourage and support residents wearing their own PPE is important. Especially for larger spaces, more people, and places with less ventilation. I think that it becomes even more important. And it may be that those places are just spots you try not to work much in, and have people come out one by one. That minimizes risk. Keep distance, keep windows open when you can. Even a fan blowing out of a window is important. In hospital settings, we work with what everybody calls negative airflow rooms, which just basically means the air from that room is vented outward, so that there's not a blower system that's pushing air into the room and then air leaks out around the door or whatever. It goes the opposite way, so that air is flowing out of that space, and you can create that with a fan, with a window fan. But yeah, the more guests wear PPE, the better off everybody is. And I know that's hard to do.
Yeah. So related to that, and you've touched a bit on this before, but just to kind of emphasize, this question is, what are the risks associated with not using PPE properly? So like, touching the masks, and, if a mask is like hanging around your neck, that kind of thing.
Yeah. Yeah, a mask on your neck is not so helpful, right? I think we all know that. And a mask over the nose, or over the mouth, but not the nose. I see a lot of that. That's also less helpful. But, some, I guess, good news in a way is the most important thing. If you only could do one thing to prevent infection for yourself, it's hand hygiene and watching where your hands go. And I can't give you a percentage of how much more protection that is than everything else, but the very vast majority, I'm not going to give a number because the number's not known, but the high majority of transmissions are from surfaces, from touching. And so if you keep your hands clean and you're attentive to where your hands go, that's the very, very best protection. And so, as a doctor, I've become pretty relaxed around germs. Some doctors get more paranoid and some don't. I'm in the less category. Over time, I've just become less anxious about germs and stuff, and am often, I do my job right, but I'm not terribly paranoid. And all to say, like in a hospital or clinic, I would never keep a bottle of hand sanitizer in my pocket ever before, and now I won't work without it because I'll use hand sanitizer, I don't know, 4 or 5 times an hour. Just sort of anytime there's a little break in something, I'll wash my hands. And so I think that's absolutely key. And then becoming attentive to where your hands go, right? The germ absorbs in mucous membranes or on any, sort of any open, wet stuff on the body, and that's really all on the face. So nose, eyes, mouth, maybe the ears. So if you touch a surface and then wipe across your eye, that's a time for transmission. And so starting now, just being attentive to where your hands go, and it's really challenging. It's really challenging. I touch my face all the time. It's just how I do. And so I have to be very attentive. Another benefit of a mask, honestly, is that it makes it much less likely that you're going to stick your finger in your mouth because it's covered, right? And so masks have great value in protecting the germ from going out your mouth into the air to somebody else. They have some value in not breathing in the virus. But I think among their virtues is you're less likely to pick your nose if it's covered by a mask. And that may be some of the value of a face shield too, honestly, right? Because then you're less likely to put your finger in your eye because it's covered up. But yeah, hands hygiene. It's hard to do, but it's also fully in each person's control, right?
Right. So the last question that I have that was submitted earlier, again, chat, if you have any questions, please post them, and you may not have this on hand, we may have to get back to people. Is there a list of locations around the city offering free PPE for individuals like our participants?
Yeah. I don't know of a list. More and more community events are popping up, and often in conjunction with like a food distribution or other services at a community level. And I don't know who's keeping a good list. That's a great question for these teams, right? We would know some things as Heartland Alliance Health. I expect all Chicago would know some things. But yeah, that's a great question. I think the other work that we'll do ongoing as, kind of shelter and homeless providers is keep pressure on the DFSS in the city and CDPH and these government entities to make sure that supply chain reaches shelters. It's not good yet, and it's much better than it was. And so I know there has been, distribution of masks to a real solid degree, less with gloves, much less with gowns or face masks or face shields. But at least masks are getting out. And if you have colleagues in a program that's been overlooked or maybe is not as intimately tied to DFSS or other government entities, let's make sure they're on the list as well. But yeah, the community stuff, I know it's becoming much, much, much more common. Like in Auburn, Gresham, and Englewood this week, there were a couple distributions that we were helpful to. But yeah, we'll have to work on a resource list. The other resource list we should get out is places for easy testing in the community. It's gotten much easier over the past 3 weeks for people to get tested. There's still a little bit of hiccup in that system for people without symptoms, and helping the testing group understand that as a shelter provider, case manager, residential worker, et cetera, that's actually frontline work at this moment. And you deserve a test the same as a nurse or doctor. Not everybody knows that yet, and we're working on that, kind of effort to make sure it's elevated. But testing in the community for individuals like us who work at the front line has gotten much easier. And we have a resource list that we've developed at Heartland, and I'm sure others have ideas. So I think that's something we should add to ongoing communication.
So how often should you only then, if you're working with clients, get tested if you're showing symptoms yourself, or should it be like a regular thing?
There is no standard. There is absolutely no standard. It's all too new. Certainly with symptoms, I think it's got great value. Certainly once, as we now get to a place where testing can be more rational and common and easy to access. Nobody's got a standard for ongoing testing. I am not going to give a recommendation about time just because there isn't a precise answer, and I don't want to just make one up on the spot. But I would say once, if you've been in a shelter setting, you've been in contact with people in ways that are part of your job and part of my job, I think testing at least once now that testing is available has some value. But the only tests we really trust at the moment are the nose swab, genetic-based detection of the virus test. It's called the RNA test or the PCR test. Anyway, the test where someone will swab out of the nose or even deeper into the sinuses and test for the actual presence of the virus. That test is quite sensitive and very, very specific. If it's positive, it's positive. There's no question. If it's negative, it's probably not there, but it does have a false negative rate, meaning it fails to detect a certain percentage of the time, maybe 20% of the time. But if it's positive, it's very, very true. It's also a point in time. It's also just one point in time. As things develop, we'll all get better access to antibody testing, which is detection in the blood of immune response and antibodies to the COVID-19 germ. And that will be more, that'll be more helpful because it would show positive if you had the virus in early March or if you had the virus in mid-April and it's all cleared from your body and you're over it. Having the persistence of antibodies is a good thing, would mean hopefully you're less likely to get infected again and more likely to have an easy time should you get infection again. But that test is not terribly available. So I'd say once is really great for peace of mind. Testing every week, probably overkill. Testing regular, there's a balance point between, paranoia and going on with safe work. And that'll evolve, and that's, as a standard develops, we'll certainly, help keep in touch with that or maybe help develop it. But there's no agreement yet.
Okay, and so those are all the questions that were submitted yesterday. So if anybody else has any questions, please post them in chat. We do have a few more minutes left. If anybody has anything, we will.
Yeah, and I would say we put this together quickly, and of course time is so tough for everybody these days. We knew that time would be, that we wouldn't catch as many people as we cared to. We'll do something like this again, or other ways of supporting, safe return to workplace or continued work in this new context. And so, questions now and questions anytime are going to be helpful, and we'll work to answer them. I also, when I try to talk about these things, I try to be fairly complete, hopefully not confusing, but I'm mindful of the fact that I gave some pretty complicated answers, and hearing them once is not going to be enough. And so we'll find ways to repeat this kind of format and other formats for training and comfort level, because the details are many. And so, I know it went by fast, and we'll come back to things.
So we'll also be posting this, like a recording of this on the All Chicago
Cool.
website. So that should be up within the next 24 to 48 hours. And then, there'll be a communication letting everybody know. I don't see any questions in chat yet. We can give it like another minute, but, like you said, everybody's kind of strapped for time. And we don't want to keep you any longer than we need to.
Cool. Well, we'll keep coming around. we'll keep coming around. My not to sound overly optimistic, because I don't think anybody should be at the exact moment, but a good effect of the crisis and increased need has been some increased visibility to the chronic problems of people experiencing homelessness, and I have some hope that we'll come through these next months or year. Honestly, the next year is going to be important with the winter and flu season coming not so long from now. Some hope that we'll create better partnerships with shelter providers and create more communication, very hopefully more on-site care in the person of nurses and doctors and others. And so, yeah, we'll definitely keep up the conversation.
And if there are more of these to have, of course, All Chicago will be communicating that out, asking for questions ahead of time so that you're a little bit more prepared with some of those answers. Though the answers you gave today were great. I'm not confused. It seemed pretty
cool.
Seemed pretty good for me.
All right.
So I think with that, there's no questions coming into chat. I think we could finish up here. Thanks a lot for your time, Dr.
Yeah, thanks, folks, for listening too.
If anybody else has questions, please feel free to email All Chicago. We're more than happy to help you. You can get us at cocprograms@allchicago.org. You can also get us at helpdesk@allchicago.org. So either way, we'll get the questions and the answers as soon as we can. It looks like Jennifer just posted that in chat for those of you who are looking at chat. So thanks, everybody. Have a good rest of your day.
Thank you.